Good evening. I come to this as a personal issue, not so much as a professional issue. When I fell off a horse 17 years ago and was in a coma for 10 days, and then in a confusional state and didn't know who I was or where I was for nearly 2 months, and I finally came to just before Christmas in 1994 and awoken to find out that I was paralyzed in the ICU at the Mass General Hospital, I can assure you that I was more than happy to call friends of mine who were physicians, and I would have asked them to help me end my life. I would not have been eligible to use the current act that is before you. In fact, there are many people who have said, and there's an argument in the disability community about whether or not this places people with disability at risk, whether it places other kinds of people at risk, young people with terminal illnesses. I can tell you that this law in fact protects people with disabilities. It protects people who may be vulnerable because the person themselves has to make the request. The issue here is, and I completely agree with many of the things that Dr. Brown has said, families should be involved, physicians should be involved, hospice should be involved. And in fact, in states where this law does exist, hospice care has improved. More people are involved in hospice care. And in fact, this procedure, this process, and the person's choice of when they're suffering has become intolerable, and they feel ready to end their life, even takes place in some hospice settings. It's for many people a much better alternative than having to allow them to die slowly. Yes, medicine has a number of good ways to try and help us die, but it can't control the timing, it can't say when, and it can't say whose choice it should be. And while, as Dr. Brown points out, some people do live longer than what the quote-unquote guesstimate may be, nonetheless, it's the person's choice whether or not they can deal with the excruciating pain that they're in, whether or not they can deal with the illness and the limitations it places on them. If they've been told they are dying, it's their choice when they want to hasten their death. And in fact, it has been found this law has been in effect, and we have to turn to where this law has been in effect to see if any of the perils or possible downsides might appear. This law has been in effect in the state of Oregon for 15 years. It's now also been in effect in Washington State, and it's also the law in Montana for only a few years in each of those states. But in Oregon, 1,000 people have obtained this prescription. Only about 600 have actually ever taken the drugs. Why? Because the notion that they have control over whether or not they can face the most difficult part of their dying process has turned to them. It no longer belongs to the doctor, no longer belongs to other people, it belongs to them. And we know that psychologically, the perception of control when we're involved in our illness or dealing with the medical profession is very important. That's why we have all these laws, as you know, that require informed consent, and that requires doctors to explain procedures to us in great detail. All of these things are important. It's the patient's decision to make. And while there are concerns about the prescription falling into other hands, things of that nature, the person would have to be taking close to 100 tablets, or at least 30 or 40 tablets. So it's not something someone's going to take out of the medicine cabinet and take a pill or two and accidentally kill themselves. In fact, there's been no recorded case of anyone accidentally taking the medication and causing their death because they were in the home where someone had used this law to obtain the prescription. And in fact, many of the patients, and we often recommend this if people ask us for counseling, many of the patients keep the prescription at the pharmacy. They don't have it dispensed to them because they want to have yet another 24-hour or 36-hour period when, if they think they've come to the end of their rope and they don't want to deal with their dying any longer, they then will go and obtain, or have a family member obtain, the prescription for them from the pharmacy. So there are any number of ways to put safeguards in place, and Massachusetts has in fact some of the best medication tracking laws in the nation. And we're not talking about sidetracking any of those laws. The Death with Dignity Act obeys all current Massachusetts laws. All it says is that it should no longer be criminal for an individual to ask for this prescription and for a doctor to prescribe it. In other words, my life, my death, my choice. And so I think that, this is the crux of the issue for me. And it's a crux, I think, that there have to be concerns, obviously. But again, physicians aren't forced to be involved in this. It's not, your doctor's decision whether or not or how and where you're going to die. Whether you want to die at home, whether you want to die at a hospital. Our doctors are there to help us through the dying process. And I'm sure Dr. Brown does that for her patients. But it's their decision to make, not hers. And the fact that, the law requires or places certain limitations on doctors, the law is not in place to improve the medical profession or to improve hospice care in Massachusetts. The purpose of the law is to give us choice. But, as I said, coincidentally, in states like Oregon and Washington, hospice care has improved. And some of the people who are involved with helping patients make choices about things like this, notably social workers, the Massachusetts Association of Social Workers has come out in favor of this law and has endorsed it. The Massachusetts Medical Society has not, and I will even go so far as to grant that the American Medical Association has not. However, the Women's Medical Association and the Students' Medical Association has. So in a generation of people, and both physicians and women, who've been brought up in an era of choice, they can't believe that they're not going to have a choice about how they're going to die. None of us have a choice if we're hit on 495 and we're killed by a tractor trailer. But if we're dealing with a terminal illness, a process that can be managed, that we can get the best pain care possible. We live in Boston, a city that's full of hospitals, full of medical schools, and certainly the best possible care can be provided. But even when the best possible care can be provided, there's some people for whom that care is not enough. There are some people who are still going to experience pain. There are some people who are going to still experience that their life for them has come to an end. Should they have to linger and wait for that to happen? Sure, 6 months is a guesstimate. No physician can accurately tell you. But, what we haven't brought up is how many people die before 6 months. How many people pass before the 6-month prognosis? Yes, there might be the occasional person who may go on, but they're more likely to be able to go on if they feel they have control and can get through those periods of bad suffering and not give up, because they know that when they're ready to give up, they will have control about that. So how much more time am I supposed to have? 2 more minutes. 2 more minutes? I will yield my 2 minutes to the floor.